Hey guys, Dr. Ryan Sousley here. Today we're talking all about how to adjust pregnant mamas. So chiropractic is the practice of aligning the spine in order to ensure proper communication between the brain and the body, because the nerves that control all the organs and tissues and cells in the body run through the spine. And so a lot of people associate chiropractic with back pain, and for sure, as a woman progresses through her pregnancy, it's really common to develop low back pain or pelvic pain or discomfort, and chiropractic can definitely help with that. But more so than that, and the reason why chiropractic can be really beneficial throughout the whole duration of pregnancy and even after delivery, is to ensure proper communication between the brain and the body. When pieces of the spine called vertebra shift out of alignment for whatever reason, either because you're carrying more weight on the front and the weight distribution's off, or just things get twisted. You know, during the third trimester of pregnancy, a woman's body starts to produce more relaxin, and that hormone does just that. It causes the ligaments, especially in the pelvis, to relax so that the baby can pass through the birth canal without much obstruction. Well, that's a good thing and a bad thing. It creates elasticity in the pelvis, but it also creates kind of an instability, which means as you progress through your pregnancy, you might become more susceptible to misalignments in your pelvis or even your spine. So I'm going to show you exactly how I adjust pregnant women. This is actually my wife, Dr. Erin. She's a chiropractor as well, but she doesn't adjust herself, and I wouldn't recommend that you try that either. But we have 3 kids, and this is our 4th. And Erin's been adjusted throughout all of her pregnancies. And the most common thing that we hear back from moms who receive chiropractic care during their pregnancy and then right after delivery is just that it makes things so much easier. You know, because Erin got adjusted through all of her pregnancies so far, we don't have a reference point, but I can tell you that I have several patients over the years who had their first child or their first couple, you know, kind of the traditional way, and didn't receive any chiropractic care, and then they had their 3rd or 4th or whatever, their subsequent children with chiropractic care, and they report a night and day difference, just because when everything's in a line, your body works better, things are more efficient, there's less pain, and biomechanically even, you know, one of the things that happens is as the pelvis shifts or can shift from subluxation, it narrows the birth canal. And that can create a whole host of issues, not to mention pain or prolonged labor. So we'll just get right to it. And
this is for comfort. A lot of people are like, well, how do you even, get adjusted or get on the table? These are pregnancy pillows made out of foam. They have little cutouts, so there's holes in them. I'm extra large for my number 4, so I have 2 pillows right now. But yeah, this helps to just enhance the experience. So I just lower myself down.
Yeah, so the biggest thing is we want to make sure she's symmetrical and she's not twisted or lopsided, but she looks pretty good. And what we're doing is we're actually using the Webster technique. So if you can maybe zoom in here, I'm going to show you what I'm looking for. So the Webster technique has become really popular with pregnant moms. It actually is a technique that can be used on anybody, but for pregnant moms especially, just because it's so specific to the pelvis and the sacrum. So one thing I'm looking at is leg length, which hers looks pretty even. Then the next thing that we're looking for is leg lag. So I just gently apply some pressure on both of her legs here. And I don't know if you can see that from there, but her left leg goes a lot further than her right leg. And so we would call that a right leg lag. So what that means is that the sacrum, which is like the keystone of your pelvis, has rotated backwards on that side, making it more restricted for the leg to bend up. So there are a couple of different ways that you can adjust the sacrum. You can use a drop adjustment or even a manual adjustment. I personally have found the most gentle and effective way to adjust the sacrum with this arthro-stim. So this is a vibrational tool that's electric, and just with a little bit of vibration and pressure on that right side or the restricted side of the sacrum, we can be really specific and apply all the force through a small space. Which is going to cause that sacrum to turn back and neutralize. So once we do that section or element, we're actually going to have mom flip over on your back, please. So the next thing that I always look for with pregnant moms, especially as they progress through their pregnancy, is any kind of tension or muscle or spasm in the round ligament. So the round ligament is one of the ligaments that really creates the shape of the uterus. And when the sacrum turns or the pelvis is subluxated or out of alignment, it can cause stress or tension on that round ligament, which can literally change the shape of the womb, and that can create positional issues for baby, delivery issues for mom and baby. So making sure that there's no tension or spasm in that ligament is really powerful, and it can alleviate a lot of pain during pregnancy. So the way that we find that is we find the belly button and the bony prominence on the same side that the restriction was, and then about halfway down and usually you can feel it, and she'll tell me. Yep, see?
Right there.
Right there. So, and it just feels like a little muscle spasm. If you've ever had like a trigger point or a knot in a muscle for some reason, that's really what it feels like. And so what I'm doing right now, here, do this so they can see. What I'm doing right now is I'm just applying a little bit of pressure with my fingertips, kind of like trigger point therapy. So it's not a lot, it's not uncomfortable necessarily. I'm not pushing really deep into the baby. I'm just sustained pressure, and eventually, usually after about 20-25 seconds, the spasm in that ligament will just dissipate, and you'll feel it. Mom will feel it, I'll feel it, everything will just kind of relax.
It's not going.
It's also really helpful to have mom breathe deep, just like you would through a massage. So taking deep breaths just kind of reduces activity in the sympathetic nervous system, which can cause or can help with everything to just kind of relax. Sometimes it holds on a little bit longer than normal, and that's okay.
I had a hard workout yesterday.
Good. All right, that feels better. So we're gonna check to make sure that that leg is gone. So let me help you. We're gonna put her back on the pillows one more time. Good. So I can notice a difference, and usually the mom will notice a difference too. Can you feel a difference in that? Yeah, so it'll feel less restricted, feel like more symmetrical or even movement. And it's as simple as that. So when addressing the pelvis and the sacrum specifically, that technique can be really, really helpful, not just to alleviate symptoms like back pain, soreness, spasm, tightness, but really what we're trying to do is we're trying to align everything perfectly and symmetrically to make sure that the baby has all the space that it needs to do exactly what it was designed to do, which is to grow and mature and eventually come out nice and smooth, and make sure that mom is comfortable throughout her pregnancy. So again, this is a technique that can be used from day one after you get pregnant all the way through delivery, and then we always recommend moms get checked after delivery too, because it's like a sporting event. I mean, I don't know personally, but I've witnessed her go through it 3 times now, and it's like an Ironman for a mom. You know, she's going through a lot, so it's a good idea just to get checked afterward. All right, hope that helps you.